I'm going to turn things over now to Dr. Wendy Graham.
Good morning, everybody. My name is Wendy Graham, and I've practiced in Port aux Basques. This is my 11th year. I went there in 1999. I'm from Rose Blanche, and I went to Port aux Basques. I thought to just start a practice for a couple of years to have a diverse practice, and I thought I'd probably move along somewhere else. The practice is great, and I love what I do. I mean, it's an honor and a privilege to take care of patients in a setting with the team that I work with. I think there's no question about that, and for any of us who've seen the ads from Newfoundland and Labrador, our tourism ads now, I mean, it's a great place to work, and that's why many of us are working here now. In terms of a little snapshot of what I do, I go to work at about 8:15 in the morning, and I do minor procedures every morning. I then round on inpatients. We have a 15-bed inpatient acute care ward. I have patients on long-term care that I see periodically as well, and then I go off to my clinic. I really should start my clinic maybe at 10:30 because I have at least 2 hours of hospital work every single morning, but I usually book at 10 o'clock because we're pushing and stretching and squeezing to get every patient in that we can. And 9:50 are one of these fit-in appointments that I have, again, to allow some room to allow people to get in who have urgent issues. I schedule a lunch break from 12 to 1, and in the earlier years, I used to schedule the last patient at 11:30 to actually allow a lunch break at 12. I now schedule the last patient at 12, and I hope to be finished seeing patients or notes or talking to pharmacists at 5 to 1 so that I can start seeing the next patient at 1. I used to book my last patient at 4 so I could leave at 5, but I now allow 4 to wherever for fit-ins again. When I do night call at our local hospital, that starts at 6 p.m. and finishes at 9 a.m. the next morning. And I frequently walk at the door at 6 because call starts at 6. I keep trying to plan an hour or so to get home on the nights I'm on call, but inevitably patient demands, guilt of people who need to see me, you know, today I'm away, so tomorrow more people squeezed in, etc. The fit-ins have really changed over the years as well. When I started out and I try to leave 5 or 6 spots a day for fit-ins, sort of like the model Dr. Callahan talked about, I now know why it's not working for me because I have about 3,500 charts, 2,200 of which have seen me in the last 12 months. That's just in my clinic. It's nothing to do with on-call or house visits and whatnot, but obviously that system is set up to fail. And these fit-ins that I imagine being rashes and sore throats and, quick things are frequently a family member whose coping has now failed. Dad has dementia, he's worse, we need help, can you admit him to hospital today? We can't get home care in place fast enough. One of the other professionals can't see him quickly enough. Or a very depressed person who's been waiting forever to see another professional. We respect our colleagues who also have long wait times, like, mental health social workers and psychologists and people waiting to see many specialists and whatnot. And at the end of the day, no matter what's wrong with you, you can go to see your family doctor. So we squeeze these people in, and sometimes an anticipated 5-minute fit-in is 1 hour long. Cancer care takes up a lot of my time these days. We're treating cancer with chemotherapy much longer. Many people are having 3 and 4 rounds of chemotherapy. It's often a reason someone is admitted to my facility under my care is getting chemotherapy. We do outpatient chemotherapy. These minor procedures that I spoke about in the morning, again, my early days in practice, they were younger people getting a mole cut off or warts or whatnot. And sometimes these minor assessments that I do before I go to clinic are pre-chemo checkups. Even in the 11 years that I've been in Port aux Basques, when I would leave town in the beginning, I'd often have to hand over stories about my maternity patients who might deliver while I was gone or whatnot. I now find it very difficult to leave town without kind of signing off with all these issues with cancer care, chemotherapy-related issues. It causes frequent interruptions in your clinic. If you have inpatients, you're going to get interruptions throughout your day. I sometimes feel I have a lot of difficulty even being in clinic. I provide a whole range of care, not only inpatient care, but I do home calls, house calls. I see patients at end of life, palliative care, and you're frequently called away from the office. I think when patients see that you're not in clinic or that they can't get an appointment with you, it seems personal. It's difficult to see you. It's difficult to see me. And there's a perception that we're on vacation or we're just booking really lightly, and we are squeezing and running things so tight. Of course, there's times we're on vacation, and we need that. You need balance in your life. But there's so many times that we're doing something else. And as patients their care is so complex, and so many elderly people with so many numerous issues, we need to keep up to date. And although there may be some funding for CME, professional development, new learning, if you really want to be up to date, you do much of that at your own expense. And again, it's time away from clinic. So there are so many things that pull us away from clinic. For those of us who provide on-call services, I mentioned how my call at my facility, we do 6 p.m. to 9 a.m. Again, you would think it would be logical, reasonable to book off your morning from clinic. And I used to do that, anticipating I'd be tired. But again, it's another time that I'm not in clinic again this morning. So I now don't do that any longer. I have clinic when I'm post-call. On the weekends, periodically, we share our weekend call. We do a Saturday and a Sunday together. It's very, very busy. It's very, very tiring. And I still work on Monday. The patient who's been waiting to see me for 3 weeks, if I cancel them on Monday morning, they don't realize I'm very tired from Sunday night. So I think these things, are putting a lot of strain on us. And when I reflect on my career to date, earlier on, I've had children since I went into practice, and there's been time since I went into practice that we've had 3 or 4 doctors in my community. We now have 8 physicians in my community. I've worked on call and done a busy family medicine clinic during pregnancies and during breastfeeding and whatnot. And my kids are a little older now, and I have more physicians now. But I'm finding it's all tighter. It's all stretched to the max. We're at a very wonderful time right now. The medical school is expanding, and doctors are retiring. New doctors want more balance in personal and professional life. So we have a wonderful opportunity. And I think if we don't fix some of these issues inherent in our system, then things are really not looking so bright. And I started out by saying it's such a wonderful profession and we love what we do. And even when things don't go well, I had a 90-year-old lady the other day, and she knew she was going to die any day. And she thanked me for the care I've offered her over the last decade. And she told me that I've not only been her physician, but I've been her friend. So, that's such a wonderful, rich thing. And to have time to spend with her was very important to her and her family. Sometimes when things don't go well, we know we can't fix everything, but I can remember one Monday morning going to clinic after a very bad weekend on call, finding it very difficult to go to clinic. It was a very difficult weekend emotionally and physically. And reflecting on a case that it really didn't go as well. I had to spend about 1.5 hours with the family. It was a very poor outcome. There were things that evolved with the whole case that I reflected on, wondered if we had given this family the best care. Lots of waits, things that didn't go well, things like Dr. Callahan referred to. And on Monday morning when I went to clinic and reflected on this family, the family asked to see me, and I saw them. And they had come to bring me a book of poetry as a thank you for providing the care that I was worried they'd be upset over because it didn't go exactly as planned. So it shows the beauty in what we do every day, and we want to do this, and we're committed to do it. But first and foremost, I think, is physician health and patient safety. And we have to do it in the right way. We need enough of us to do the job well. It is a great job, and we want to keep doing it. But when we can't see more patients, it's because the complexity is quite high. Chronic disease is very prevalent. Each patient takes a lot of time. Patient expectations are high, and so they should be. We want to deliver a very good product. Our patients are aging, and they have complex issues. There's not enough of us, and basically there's not enough of a lot of the other professionals as well. And very simply, more doctors equals more care, so we need more of us to do the same job. Thank you.